Welcome to the Cusa Clarity Setup tutorial. Designed for quick and easy setup, the Cusa Clarity is ready when you are. This video provides a brief overview of the Cusa Clarity handpiece and console assembly. Let's get started. Section 1. Setup of the Cusa Clarity handpiece. Always perform handpiece setup in the sterile field. The following components are needed: the handpiece, the tip pack, the torque wrench, the torque base, and the Cusa Quick Connect cartridge and tubing set. First, thread the tip onto the handpiece, turning it until it is finger tight. Working on a stable, flat surface, place the handpiece into the torque base. Ensure that the two flat metal sides of the handpiece fit snugly into the slot at the end of the base. Hold the handpiece in the base and slide the colored side of the torque wrench over the tip. Rotate the wrench clockwise for 2 clicks. Align the dots and slide the nose cone over the tip, twisting clockwise until it locks and the 2 white dots are aligned. Remove the stylet from the flue and slide the flue over the tip and fully onto the nose cone. Remove the Cusa Quick Connect cartridge and tubing set from its packaging using proper sterile technique. Connect the aspiration and irrigation tubing to the end of the handpiece. Attach the flue tubing to the clip. The handpiece connector can now be attached to the console. Section 2. Setup of the Cusa Clarity console. Be sure that the handpiece is fully assembled prior to setup. Note that the console setup takes place outside the sterile field. The following components are needed: the Cusa Clarity console with contamination guard, the Cusa Quick Connect cartridge and tubing set, the sterile handpiece, the foot switch, and the suction canister and IV bag. Place the suction canister in the holder. Connect the tubing of the contamination guard to the vacuum port of the suction canister. Connect the power cord to the back of the console and into the power supply. Press the power switch to turn the system on. Now, simply follow the steps on the screen. After you successfully complete each step, a checkbox appears. If you have questions, you can press the question mark to the right of each step to get more information. Attach the foot switch cable to the rear of the console. Plug the handpiece into the front of the console. Align the red dot on the handpiece connector to the red dot on the console. Lift the cartridge door, insert the cartridge, and slide it down. Then, close the door. Connect the aspiration tubing to the patient port of the canister. Lift, turn, and lock the IV pole on the back of the console. Spike the IV bag and hang. Ensure that the clamp is open. Now, let's prime and test the Cusa Clarity. First, press the prime button. Once fluid flows from the tip, press the prime button again to stop. Then press the test button and wait for a check mark to appear. Nothing should be touching the tip when pressing the test button. Press the main screen button to begin surgical use. At any point, you can instantly access help by pressing the question mark located at the lower right portion of the main screen. The touch screen allows for simple interaction and adjustment of all settings: amplitude, tissue select, aspiration, and irrigation. To shut down, just press the power button. This completes our overview of the Cusa Clarity setup. It's quick, it's easy, it's ready when you are. Cusa Clarity for fibrous tissue resection. Empower performance.